Welcome back. So today we're talking about acid reflux and heartburn. How do we overcome these things without taking acid blocking drugs? So I hope you're ready for this. Heartburn, it's something that 60 million Americans experience on a regular basis. Many people, they just pop an acid blocker or a Tums, twice daily when symptoms show up, not even thinking about it. Now, I want you to understand off the bat here that doing this creates a future of more heartburn, more gastroesophageal reflux disease, and more indigestion. Not to mention, vitamins and minerals are being depleted due to malabsorption because of maldigestion. And this increases the risk of prostate cancer, heart disease, dementia, gastric cancer, anemias, both B12 related and iron deficiency related anemias, as well as osteoporosis, arthritis. None of that sounds fun, right? That sounds terrible. But of course, our instant gratification, it often gets in the way of our long-term desire for health accumulation. If you haven't already, hit the like button, hit the subscribe button, because this really helps get this information out to more people more efficiently. And we want really a community of people who are accumulating health. So thank you so much. Now that you've been made aware of the fact that acid blockers are not a desirable long-term solution, I suggest we get into how we can solve reflux and heartburn issues. And I would mention, this is not just me, a proponent of naturalistic measures, naturalistic therapies, saying acid blockers are not the best thing long-term. They're not the best solution. The FDA, Federal Drug Administration, explicitly states that you should not take acid blocking medications for more than 14 days. And you should not do a 14-day course more often than every 4 months. It's pretty wild, right? But consider, most people, they start, say, omeprazole, and they take that omeprazole the rest of their time on Earth. The thing is, you can't just let acid reflux continue. Or you could end up, in a state where you get, esophageal cancer, which we call Barrett's esophagus. So if we are taking acid blockers long-term, we're going to run a significant health risk. And just the same, if we're just letting acid reflux go crazy and just, continue on, we're also having significant health risks. So what we're left with is literally solving and healing reflux. And the first thing I would do if you have chronic acid reflux is get tested for H. pylori, Helicobacter pylori, this bacteria. Now, this can be done via a stool antigen test or a urea breath test. Probably have to do this with a doctor. Both methods are pretty much comparable, specificity-wise, sensitivity-wise. But if you come back positive on your H. pylori test, then you're going to need to kill H. pylori to help support the ridding of heartburn, acid reflux from your life, ulcers forming in your stomach. This is a big deal. If you don't get rid of it, just eating good probably isn't going to be sufficient. Now, how you're going to go about getting rid of it, that is a discussion for another day. The second thing you want to do is look at your body composition. Do you carry excess belly fat? Does your belly roll over the top of your pants, roll over the top of your belt? If so, you're going to want to get rid of that belly fat. I'm being totally serious right now. 100% yes, you want to get rid of that belly fat. I know this is going to be challenging, of course. We're talking about healing your body, not just putting a Band-Aid over something that will break at some point and leave you in a world of hurt. We're talking about changing your life, healing. And so it's going to start with daily decisions. It's going to start with your food decisions. It's going to start with your activity levels and getting that belly fat gone. The thing is, you can start right now. You can start this today with the next decision you make related to food, the next decision you make related to activity. I would suggest, get a coach, get a trainer. If you really want transformation in your life, you literally can even send us an email at info@drwholeness.com, and I will create a plan and I will hold your feet to the fire. That is not free, but you can if you like to. I know how challenging it can be, but the reward is totally worth it. Number 3, the most prominent heartburn promoting foods are fried foods, fast food, pizza, tomato sauce, citrus, potato chips, crackers, vegetable oils, canola oil, soybean oil, corn oil, prepared meats like sausages and bacons, white breads. you got to send these foods out of your life immediately. No questions asked, they're gone. All right, number 4, stimulate your gastric secretions to lower the pH before you ingest your meal so that your food can literally move through your stomach more efficiently. So a low pH, an acidic environment, is required for the reflex arc to go back and cause your esophageal sphincter to close up. If you don't have enough acid in your stomach, there's not going to be that reflex arc, and you're literally going to have food in your stomach being digested via intense acids. And those acids are going to spit back up. They're going to be spitting back up. And your esophageal tissue, it's not meant for this pH of 2, 2.5 like your stomach is. And you're going to get, scarring, you're going to get calcifications, and you're going to get pain. You're going to get that heartburn pain after meals or even during meals. Recognize that the majority of people with acid reflux do not have too much acid being produced. They have too little. And like I said, that pH isn't getting low enough. Because it's not getting low enough, their sphincter is not closing. If it doesn't close, you get acid on the esophagus, you get pain. So this might be shocking to you because we're giving people acid blockers to help with the reflux. I mean, I'm not giving it to people, but a lot of people are doing that, right? But the thing is, we're just backwards so much in medicine. Instead of going towards, let's heal this, we go to just instant symptom relief. And of course, instant symptom relief rarely is a long-term strategy for health accumulation. By using things like apple cider vinegar, bitter herbal formulas, lemons, limes, you can stimulate your own secretions from your mouth all the way into your digestive tract to make digestion more efficient. And you can also even take, betaine hydrochloric acid, to increase stomach acidity and also, basically more efficiently incinerate the food you're consuming. So if you have more gastric secretions available, you're going to digest food better, bottom line. Number 5, you got to utilize the esophageal and that stomach lining healing herbs, such as deglycerized licorice root. So deglycerized licorice root has the glyceric acid part removed. And so it will not affect your blood pressure and such things like that standard shred of licorice root could. My wife, she uses DGL, or deglycerized licorice, when she's pregnant because she will get some heartburn during pregnancy. Marshmallow root is another great one, especially in tea form. You just want to make sure that when you use marshmallow root, you let it cool. Let it be really mucilaginous and thick. That will be most helpful to soothe the stomach and the esophagus. Also, aloe vera syrups or even aloe vera powders can be really helpful to soothe the esophagus and the stomach lining. And I would put those more as an immediate effect, something you do just acutely, got to help myself out. Those are great options. All right, number 6, watch out for the mint family. The deal is with the mint family. I know they can be tasty, feel like, relaxing, these kind of things, but the mint family can actually relax too much the gastroesophageal sphincter. And that can actually promote acid reflux because if that sphincter can't clamp close and it's kind of open a little bit because it's too relaxed, you're going to get reflux. And this is, the mint family is most commonly encountered via like chewing gum, mints, mint teas. So I really watch out for those all the time. Patients come in, like they're on heartburn medications, they got reflux all the time, and they're chewing mint gum, every day. So be very careful there. All right, I hope this is super helpful for you. Let me know what you've done to help yourself out overcome acid reflux heartburn, because so many people over the years have done so many unique things for their unique situation and gotten results. And I would not discount any of those results. You want to share them. You want to let people know what you did, because by you letting somebody else know, more than likely there's somebody out there who can benefit from that and could actually follow your plan, and it would benefit them as well. All right, I'm Dr. Matt. Let me know how you're doing. Keep it cute and health, and I'll see you guys next time.